All right, we are going to get started. This is Dr. V. You're on the Dr. V's webinar. Everything you want to know about COVID-19 and the vaccine. My name is Dr. Valda Crowder, and I'm an emergency medicine physician. I've been practicing now for 30 years. The source documents for this information is at AskDrV.us. You can also follow me on Twitter on AskDr_V. All of these presentations are dated. And this is December 15th, 2020. A recording of the presentations that do not include the Q&A will actually be on our website. So the structure of the presentation is as follows. We're doing a slide presentation for 15 to 20 minutes, followed by Q&A. We normally end up right around 9 o'clock. During the presentation, everyone will be in listen mode, and you can ask questions using the chat icon or using the Q&A. So you can actually begin typing in the presentation while the presentation is actually going on. You don't have to remember your question. But the chat icon or the Q&A, I will get the questions from either, and we'll answer any written questions first. All right, so the intention of this webinar is to keep webinar participants informed with COVID-19 science that will help you and your family stay healthy and happy during this pandemic. The outcome is that you'll leave the webinar motivated to create or improve an action plan for yourself or your family, or you may be motivated to create or improve an action plan for a broader community. Maybe you represent a church or a union or a business, or you're an employer. So it may be a broader community that you're responsible for. The first 98 days is what it took for us to reach 1 million cases. Then 44 days to reach the next 1 million cases, 27 days to reach the third 1 millionth case, 15 days to reach 4 million cases, 17 days in the summer, we started leveling off a little bit, 17 days to reach the next 1 million cases, 22 days to reach the next 1 million case, 25 days in September to reach 7 million cases. Then as we went into the wintertime, it was 21 days to get to another 1 million cases, 14 days to get to 9 million cases, 9 days to get to 10 million cases, 7 days to get to 11 million cases, 6 days to get to 12 million cases, 6 days to get to 13 million cases, 6 days to hit 5 million cases. And we are now hitting over 200,000 cases a day. And we did 1 million cases in 5 days as of December 8th. So you can kind of see the progression, sort of how we went from 98 days to 1 million cases, all the way down to 5 days to 1 million cases. So the speed at which this infection is spreading through the country is alarming. One of the main things that's important is looking at our capacity of our healthcare system. And that is the main reason why you're seeing all of the stay-at-home orders and the shutdowns. San Francisco is projected to run out of beds by the end of December, as well as the state of California. And that is a really big deal. I mean, primarily this is ICU beds. And the issue, people talk about bed and bed capacity, but the issue is really the staffing that you need, the specialized staffing that you need to run an ICU bed. Now, a lot of people have asked me about the fact that I'm not flying. They want to know why. So I wanted to talk about it. So for a while, they were blocking the middle seat. Southwest Airlines actually unblocked the middle seat as of November 30th. I actually took a look, and you can feel free to take a picture of any of these slides if you want to. But as you will see, there are several airlines that have varying policies on different things. So one, masks are not available at Frontier or Spirit or Sun Country if a passenger flies and does not have one. Masks are required at all of them. Not all the airlines are cleaning their plane before they fly. Allegiant, Spirit, and Sun Country are not cleaning the flight before the plane leaves. Then the other thing is who's selling the middle seat. So the only one that has reliably said that they're not going to sell the middle seat is Delta, and that is until March. Everyone else has either started selling the middle seat or has a date by which they will start selling the middle seat. Then you have couples like this who knew they were positive. They flew to Hawaii. We know for sure there were 2 positive COVID patients, if not more, on this flight who flew. They were arrested when they arrived in Hawaii for endangering the public. But because we don't have very good testing before people are getting on these flights or afterwards or having anyone sign any affidavits, you're really kind of operating on an honor policy, which is not really the best policy to operate with something that's so serious. Recently, I don't know if you guys remember this guy, but this is the ocean spray cranberry guy. I think everybody remembers he actually won a truck for his viral video about ocean spray cranberry. Well, apparently he didn't want to put a lot of mileage on his new truck, and instead he decided to fly, and he caught COVID-19. Now, the other thing that's happening is state by state, there are certain states that have moratoriums in effect. The ones in purple have moratoriums in effect where utilities cannot be shut off or there cannot be evictions. In red, you have no state moratoriums, and there can be shut off of utilities as well as evictions. We have a Florida man. He stepped up and paid the utilities for 114 families that were actually getting ready to have their utilities shut off. So we have heroes in the midst of all of these things. The other thing that actually really shows how much Americans are struggling is we're seeing a dramatic increase in shoplifting of food and hygiene products in the midst of the pandemic. So people are really struggling. Now, we talk about respect. COVID-19 is highly contagious. It can be caught in under 45 seconds. Very, very different from the flu. The flu, 30 to 40% of the people who come in contact with it get it. COVID-19, 60 to 80% of the people who come in contact with it actually get it. This is just the article where the CDC actually said you can catch COVID-19 in under a minute. It doesn't have to be coughing or sneezing. It can be regular talking. We've discussed before, it's both a droplet and an airborne disease. Droplets are larger, 5 microns in diameter, and they actually fall 3 feet from the place of origin. Example of droplets are Ebola, pertussis, mumps. Airborne are smaller particles that are inhaled. They're less than 5 microns, and they can land much, much further than 5 feet from their place of origin. Think tuberculosis or measles. This is just sort of a schematic here, which shows you what it actually looks like if you imagine that this person is COVID-19 positive. When they're talking or coughing, they are either spewing out droplets, which are in the red, or in the gray, which is airborne, which can go much, much further. It really depends upon the humidity and the temperature, etc. All right. So how do I know if myself or my family have COVID-19? There's 3 ways to actually get tested: PCR testing, antigen testing, and CAT scan findings. PCR testing is the gold standard. You know that you had this test. This is the best test to have because it's extremely uncomfortable. They put the swab very far up your nose. It's most accurate 8 days after exposure. The antigen test is what we call the rapid test. This test actually detects proteins that are on the surface of COVID-19. And it is actually negative when you have COVID-19 about 30% of the time. So I'm going to repeat that again. You have COVID-19, about 30% of the time, the person will have COVID-19 and the test will still be negative. So if the antigen test or the rapid test is positive, it's true. If it's negative, you probably need a new one. All right, CAT scan is another way to actually determine that you're positive. I'm just going to blow this up here because this is really hard to see, but the little yellow arrows kind of show the white opacifications, and that is the what we call ground glass opacifications that is known to be COVID-19. Now, here's the thing that's very interesting. COVID-19 also has an odor. Dogs are very, very, very accurate at actually detecting COVID-19, and some countries have been looking at using them actually in airports. COVID-19 has 6 cluster symptoms. We say 7 because one cluster is completely asymptomatic. You can get COVID-19 and be asymptomatic and also transmit it and be asymptomatic. But if you do have symptoms, the earliest symptoms are loss of smell or taste. Cluster 1 is flu-like symptoms with no fever. Cluster 2 is flu-like symptoms with a fever. Cluster 3 is gastrointestinal symptoms. So you feel like maybe you ate something that was wrong. So you might have vomiting and diarrhea. So clusters 1, 2, and 3 are usually self-limited, and people often take care of that at home. Cluster 4, 5, and 6 are the more serious ones. These are the ones where the patients get admitted, wind up in the ICU, or die. Cluster 4 is fatigue with all the other symptoms. Cluster 5, one gets confusion with all the other symptoms. And cluster 6, you get everything together: fatigue, confusion, respiratory symptoms, abdominal symptoms, etc. Now, I've had a lot of questions on this webinar about this, so I've added a couple of new slides here specifically about COVID versus the flu, okay? Because people have asked me multiple times, well, isn't it just like the flu? So I want to go over how it is not, okay? So 1, the flu is a respiratory disease. COVID-19 is a multi-system disease. COVID-19 is a body-wide inflammatory disease that impacts the brain, the heart, the respiratory system, the renal system, and the clotting system. If you actually look at the number of people that get the flu in a year, it's roughly about 45 million to 58 million people. That's actually everyone, right? We've had 16 million people that have gotten COVID-19 in 9 months. So the difference comes when you actually look at the deaths. The highest we've ever had from the flu is we had 1 year where we had 95,000 people die. But every year we have mainly roughly around 50 to 60,000 people die a year from the flu. We have 300,000 people, so 5 times that number of people, who have died in 9 months. We have not even made it to a year yet. We will be a year in February or March. So this is why I say that it's way deadlier. It's 5 times deadlier than the flu. Now, the other reason to actually take a look at why COVID is very distinct. If you look at COVID-19, it is so contagious that we have basically had to shut down all other parts of the hospital. So any sort of elective surgeries or elective procedures, elective x-rays, etc., have all been shut down. Also, if you look in the hospital, 100% of the ICU beds are COVID patients. We never have that during flu season. So during flu season, we have flu patients, but we also have a normal functioning hospital, right? This is all because of the seriousness of COVID-19. As I said, COVID-19 is a multi-system disease. It involves the kidneys, the heart, the brain, the blood clotting system, etc. You have patients who have recovered from COVID-19 who have had double lung transplants. We do not see that with the flu. In addition, we have patients who have been in the ICU who we haven't been able to ventilate, and we have to put them on ECMO. You do not see that with the flu, and I will also talk a little bit about what ECMO is. So just giving an example here, Keontae Johnson, who is a star forward for the University of Florida basketball team. He is, 18 or 19 years old. He collapsed, fell flat on his face. He had COVID-19 in the summer, relatively asymptomatic. And then today fell flat, not today, but I'm sorry, I think this was a day or two ago, fell flat on his face during a basketball game. And he is now in a medically induced coma in an ICU. So the other thing that we're seeing with COVID-19, which is different from the flu, is that when you're over it, you're not really over it. People are having side effects and symptoms that are 6 months after being over COVID-19 or supposedly being over it. There's also a White House security officer He had his right foot amputated. He was part of Secret Service, and he's facing staggering medical bills related to COVID-19. We don't know why some people actually have a more serious infection. What they've actually found is that they are beginning to look at, there may be genes as well as blood type that play a role in certain people getting more severe COVID-19 infections. All right, so now what happens if you just found out you got COVID-19 or somebody in your family did? Let's talk about what you need to do. You want to quarantine immediately, preferably for 21 days. The recommendation is 14 days, but preferably 21 days. We found that about 6% of the people are still positive after 14 days. If you want to quarantine for 14 days, I would recommend actually getting a test to actually confirm that you're actually negative. You also want to buy a pulse ox, which is one of these things here off to the right. They are also found on your Apple Watch, or if you have, there's little apps that you can download. So SpO2 is your oxygen saturation. On this picture here, it's 97%. You want to actually get one of these. These are about $30 on Amazon, and you want to check your oxygenation. What happens with COVID-19 is that you're not oxygenating well. So in other words, your body's not getting enough oxygen, but you do not feel short of breath like you normally would if you had a pneumonia. So it gives you a false sense that you're actually feeling fine when you're not doing fine. The other thing is zinc and vitamin D3. The dosages are all here. You want to have access to a bathroom that's only used by you. You want to have your cell phone. If you get into trouble, you're calling 911. You're not calling a family member. If you call a family member, you're going to give them COVID-19. You want to have people leave food at a door. You want to open up the windows in your house and possibly even get a HEPA filter if there's other people that are living with you in the home. Now, let's talk about what we do to treat COVID-19. We know that we give people oxygen, vitamin D, zinc, famotidine, dexamethasone or decadron, remdesivir, antibody cocktails, and then also there's ECMO. So I'm going to go through each of these. I'm not going to go through the oxygen, vitamin D, and zinc because most people know what that is. But what is famotidine? Famotidine is Pepcid AC. Now people say, well, I don't really have a stomach problem. Well, what they don't realize is Pepcid AC blocks histamine. So if you have an allergic reaction or you have anything that's an inflammatory reaction, this medication is good to actually block inflammation. So it's been found to lower deaths and lower combined improved outcomes and lower intubation rates amongst COVID-19 patients. Steroids is another way in which you decrease inflammation. We normally use dexamethasone, and it lowers the 28-day death rate for patients that require oxygenation or ventilation. Remdesivir is something that you actually hear about. It's really of questionable benefit. Some people say, some studies have said that it may get you off the ventilator a day or two early, but it hasn't really been shown to really make a difference in overall outcome. Regeneron is the name of the company, but basically they have an antibiotic cocktail, and so does Eli Lilly. So these are two antibiotic cocktails. They include antibodies from a human that has recovered from COVID-19, and then a second antibody from a mouse engineered to have a human-like immune system. And in both cases, it provides antibodies to the spike protein of the COVID-19 virus. Eli Lilly got emergency approval, FDA approval on November 10th. So now people ask me, what is ECMO? So ECMO stands for extracorporeal membrane oxygenation. Extra meaning outside, corporeal outside the body, membrane because they use the membrane, and oxygenation because what it does is it basically oxygenates the body, the blood. So just to actually just show you what this actually looks like, this is actually where they use this for bypass surgery and certain things like that, where you don't want the heart pumping or moving while you're actually working on a patient, but we also use it in transplant and also with COVID patients. And basically what it does is they open up the chest, they put 2 cannulas in, and they actually take the blood out of the body, oxygenate it in that machine, and then send it back into the body. And this is because, you know, a patient being on the ventilator sometimes can cause a lot of different problems as far as it can shut down your kidneys. This is a way that allows you to oxygenate someone that maybe you're having difficulty oxygenating on a ventilator, or they've been on a ventilator too long. All right, after you have COVID-19, we all know now that your immunity goes down. You can catch COVID-19 twice. This woman here, she's 102. She lived through the 1918 flu, and she actually had COVID-19 twice. So let's talk about the vaccines, because that's everything that's going on right now. So if you look at the photo there, you have the orange inside, which is the virus, the actual round circles there in a semicircle. Then you have the spike proteins on the outside, and then you have the receptor protein, which is on your cell. So the spike protein fits into the receptor protein, and that actually lets the virus into your cell. Once the virus gets into your cell, it begins making copies of itself over and over and over again. So messenger RNA is the thing that tells it to make copies. So it's making copies over and over again. Then it reformulates and it goes back out, and then it attacks another cell. So old vaccine therapy used weakened or dead virus. Think of polio, influenza, measles, mumps, rubella, those types of vaccines. New vaccines are using what we call RNA. So specifically, these ones are using messenger RNA. So messenger RNA transfers genetic information from the genes to the ribosomes, and it tells it synthesize the protein. And in the case of COVID-19, the protein that they're synthesizing or making is COVID-19 viral antigen. So how do the new vaccines work? So Moderna and Pfizer both work with 2 doses, and they have a messenger RNA approach. And basically what they do is it tells the body to actually produce the spike protein. Then once you produce the spike protein, the body recognizes as foreign, develops antibodies to it, attacks it, and kills it. So now when your body sees a real COVID-19 in the community, it's ready. So this is the Pfizer vaccine is the vaccine that you see now that you see people getting on TV that has been shipped around the country. Johnson & Johnson is what they call a viral vector approach. That uses adenovirus, which is simply the common cold. Okay, so adenovirus is whenever you got the common cold and you went into the doctor and he said, I can't give you antibiotics because you just have a virus, that's adenovirus. So they've combined adenovirus with a piece of COVID-19, and they put that into your body so that your body recognizes it, produces antibodies, and renders it all harmless. So let's talk about how many doses, effectiveness, side effects, storage, peer-reviewed data. Let's talk about it all. Pfizer is 2 doses, 92% effective. Side effects are soreness, fatigue, headache. People are also getting fevers and chills. It requires cold storage at -75 degrees, has not come out yet as peer-reviewed. There were 4 experts that actually voted no on authorizing COVID-19. Those 4 experts objected to a couple of things. So one of them objected to children that were between 16 and 21 getting the vaccine. They felt that it should be only for adults. One of the other experts who voted no actually felt that there were not enough minorities in the experimental protocol. Okay, Moderna, also 2 doses, 95% effective. Similar side effects, muscle aches, severe fatigue. It requires cold storage at -20 degrees, which is more like a freezer. We also has not been peer reviewed yet. It has actually been shown to be highly protective and almost 100% protective against severe COVID-19. Kizzmekia Corbett is an African-American woman, and she is one of the main developers, a leading virologist that is one of the major developers around the Moderna vaccine. Now, the other thing that the CMO about Moderna says is that it prevents people from getting sick. It doesn't necessarily prevent people from getting the virus. So that means you could get the vaccine and actually still spread COVID-19. So it will require that we will still wear a mask until we get significantly over this fall. Johnson & Johnson, we don't know that much about this. It's still in the experimental protocol, still in phase 3. It is 1 dose. We don't know effectiveness because they haven't unblinded the study. We don't know anything about side effects or distribution. This just again goes over the fact that once you're vaccinated, you will still need to wear a mask because it looks like there may be, you may still be able to spread this to others. 2 vaccines, the Pfizer CEO said, hey, what about skipping the 2nd dose? He said it would be a very, very big mistake. You do get a small amount of protection from the first shot, but it really requires 2 shots to be effective. Now, this is a little bit about a framework that was developed in October that the CDC has adopted around who's going to get it and when, because that's what everybody wants to know. So right now they're vaccinating 1As. So 1As are frontline healthcare workers, nursing home medical staff, as well as the nursing home, the people who live in the nursing home. 1B is going to be 10% of the population. That is going to be those folks with significant comorbidities and underlying side effects. Phase 2 is going to be those that are teachers and school staff and childcare workers and how to quickly get back up school and childcare education. Phase 3 will be those folks in forward-facing or publicly facing professions. So if you think about hotels, banks, grocery stores, that will be phase 3. And phase 4 will be everyone else. So when you look at this, it's about 3 million people in long-term resident care. Those folks would need about 6 million doses. You've got 20 million healthcare workers that would need about 40 million doses, and you've got 80 million people that are essential workers that need 160 million doses. So it is actually a lot of doses just to get through those groups of folks. All right, I get a lot of questions about air purifiers. You know, there are a lot of different air purifiers. You want to try to find ones that are ozone free. They filter down to either 0.3 microns or 0.1 microns. 0.1 microns are actually the hospital grade air purifiers. Some of them are kind of noisy, so you kind of want to look at, you know, how noisy are they? Do they have a sleep mode? Do they have an indicator that tells you when it needs a new filter? How much is the new filter? And how big of a room do they actually purify? I just took a picture of the one that I purchased. This is a hospital grade air purifier. I got a smaller one that does the smaller space so I can kind of carry it with me. I got it on Amazon, I think for about $70. So that's an example of one that I